Picture this, it's a snowy January morning, 20 below zero. You are alone walking from your car to work. You look over and notice a man lying flat on his back, unconscious with a shovel by his side. What would you do? How many of you here tonight would know how to handle a situation I just described? According to the American Heart Association, less than 1/3 of all cardiac arrest victims receive bystander CPR. In the same report, immediate effective CPR can increase a victim's chance of survival by 3-fold. As a nurse, I'm required to maintain CPR certification. I've had the ability to use these skills many times in my nursing career. In order to effectively administer CPR, we need to know the proper sequence to follow and be confident in our ability to perform this skill. I'm here tonight to demonstrate for you the American Heart Association's sequence of steps for one-man adult CPR. Before we're able to save a life, we need to make sure that our life is not in jeopardy in any way. We also need to determine if the victim is truly in need of CPR. According to the American Red Cross, every emergency scene needs to be assessed. To do this, we need to check our environment for any signs of danger. Any vehicles, any fire, any downed power lines, any signs that our life may be in danger. Be safe. Make sure your environment is safe. Don't be a victim while trying to save someone else's life. My assistant Kayla will help us through this demonstration. First, we need to check the response of the victim. We call out to him, shake him, vigorously rub on his sternum. No response. Call for help. Call out for help. Call 911. We need to assess this victim's breathing. To do this, we need to open his airway. Take into consideration any trauma to his neck or spine. If none noted, we will place one hand on his forehead and push down, the other hand under his chin and pull out. We need to assess for breathing. Place your cheek down by his mouth. Feel for any air movement. Watch to see if his chest rises or falls. Listen for any air movement through his nose or mouth. No air movement noted. What next? We need to begin rescue breathing. Pinch his nose, completely shut. Seal his mouth with yours, tightly making that seal. Give one breath. Watch for the chest to rise and fall. If this doesn't occur, we need to reposition his head and try again. Give another breath. We'll repeat this step for breath number 2. Pinch his nose, seal your mouth around his, give another breath. If the chest doesn't rise or fall, we need to reposition. If we still aren't able to get a breath, we need to move on. But we're going to assume that we have 2 breaths into our victim. What's our next step? We need to check his pulse and deliver chest compressions. To locate the pulse, we need to find the carotid artery located on each side of the windpipe. Check this pulse for 5 seconds, no longer than 10. If there's no pulse, we need to move on to our final step, which is chest compressions. Place one hand over the other on the victim's breastbone, right between his nipples. Press down hard on his chest at a depth of 1.5 inches to 2 inches. We're going to do this at a rate of 100 compressions per minute. We're going to do 30 chest compressions, and then we're going to give 2 rescue breaths. 28, 29, 30. Breathe. And breathe. We're going to continue this cycle of chest compressions and rescue breathing for approximately 2 minutes. All right, 2 minutes is up. We're going to breathe and breathe. Now we need to check the victim for breathing and make sure we check the pulse. No breathing, no pulse. We would resume CPR until help arrives or until you are physically unable to continue. If the victim has a pulse but is not breathing, we deliver 1 rescue breath about every 5 seconds until our help arrives. If this victim is breathing and has a pulse, we roll him on his side in the rescue position, continue to assess his situation until our help arrives. The American Heart Association recommends if for any reason you're unable to do rescue breathing during CPR, at the very minimum we need to do chest compressions. We'll do this at a rate of 100 per minute. Okay, so let's review here. What we're going to do is we're going to assess our scene for safety. We're going to assess the need for CPR. We're going to call for help, assess breathing, open the airway, check our victim's pulse, and last but not least, we're going to deliver our chest compressions. You too can save a life. By performing the steps that I've demonstrated for you, we can make a difference in somebody else's life.